opportunity to share some information with you about health. We're trying to arrange a microphone so I can stand there so you don't have to look here and look there at my slides. But before I get to my slides, I also have to watch my time because I have so much material, like Dr. Harrigan, that I don't want to go over time. But I want to say welcome to our visitors from Japan. I don't know if I should say Ohayo gozaimasu. It's kind of getting late in the day. And aloha kakahiaka, which is Hawaiian for good morning. But we welcome our visitors from Japan. What I'm going to talk about today is the effectiveness of integrative medicine on obesity and chronic disease, which has been my specialty. But I'm just going to say a couple of words because I do want to show a couple of videos of people actually getting well doing a whole person approach to health. But I got involved with this because, as you know, I was a lawyer first, and I quickly got fed up with the way law was practiced. I call myself a recovering attorney. And so I went into medical school, and I quickly got disgusted with the way medicine is practiced. I have a low tolerance for baloney, shall I say, instead of using another B word. But this was my experience in med school. How many of you, I went into medicine because I didn't want to fight with people in law school, in law. I wanted to heal people. I thought that was, less conflicting. How many of you think doctors ought to learn how to heal people? Well, isn't that a silly question? But let me tell you my experience in medical school. I go through 4 years. In my 4th year, I'm sitting at Queen Emma Clinic with a preceptor. We've gone through all our training. We've seen many patients in the hospital. We've taken care of very sick people. And our training is to now see patients one-on-one. The preceptor is like a mentor. We see the patient, we look over the labs, blood sugar is high, blood pressure is high, cholesterol is high. The doctor says, okay, we're going to give these medicines. Doctor leaves the room, so I learn how to counsel the patient. And so I tell the patient, okay, you have to take this one in the morning, this with food, this with, so forth. And the patient asked me a really fair question. Doc, when will these medicines cure me? How many of you think that's a fair question? What's my answer? Never. You have to be on it the rest of your life. If the pills never cure the patient, did I learn how to heal that patient? It was a stunning realization that I went through 4 years of medicine and I didn't learn what I came to learn. It's a sad commentary on our healthcare system. Because so many of the diseases are nutrition related, I went and got a degree in nutrition after medical school. I was a lawyer first, right? I'm treating diabetes, which is a nutrition-related disease. How many of you agree diabetes is a nutrition-related disease? Of course, right? It's blood sugar. You know what I thought? Because I was already a lawyer. My God, this is malpractice. I'm treating a nutrition disease and they didn't teach me about nutrition. Same thing with heart disease. Same thing with cancer. Same thing with stroke. Same thing with arthritis. Same thing with on and on and on. So that's why I learned how to heal people when I studied nutrition and lifestyle and then other modalities. So that's how I got here. The Dalai Lama says we have bigger houses, smaller families. More conveniences, less time. We have more knowledge, but less judgment. More experts, but more problems. And more medicines, but less health. How many of you agree with all this? You see the problems we face in this world, in this country? Here's the problem we have with obesity. I'll go through this quickly. This is the epidemic of obesity that is sweeping across the country. This is 20 years worth. This is the darker the blue, the more the obesity, 97, 98, 99. It's an epidemic. 2001, 2002, 03, 04. It doesn't end. 88, 2008. It's an epidemic that's silently taking over the country. And what comes along with obesity? Heart disease, diabetes, hypertension, strokes, cancer, all the things that are now killing us slowly and sometimes quickly. These are the leading cause of death in the US. Heart disease is number 1, cancer 2, stroke 3. All the red ones are nutrition related. 6 of the top 10 are nutrition related diseases. If you add that up, it's 2/3 of all our deaths. If 2/3 of all the deaths are nutrition related, how many of you think 2/3 of the resources should go into nutrition medicine? Well, doesn't that make sense? Do you know how much goes into nutrition medicine now? Nothing. If I counsel people how to get off the medication, insurance companies don't pay a thing. In fact, I get penalized because I spend the time and I don't get reimbursed. So why are we getting fat and sick? Well, part of it is the diet's changed, but look at this. This is what I call integrative medicine. Prayer, thoughts, feelings, energy medicine, sunlight, activity, physical modalities, air, water, food, herbs, supplements, and drugs. You know what the problem with our medical system is? They only pay for the drugs and surgery. You see how much we're missing. And I compliment the Mokichi Okada Association for seeing this many, many, many years ago. The truth is, in ancient times we knew this. It's just that our current drug and surgery focused system has taken over the system. And by the way, they're paying for all these drugs. Do you know what the startling new 4th leading cause of death is in America? Prescription medication. Now think about this, okay? Think about this. And by the way, this is the Journal of American Medical Association. It's not my data. It's nationally recognized data. Think about this. If I see a person with diabetes, with the 6th leading cause of death, actually, do we have the mic set up there? Yeah. I'm going to go down there so you don't have to look here, go over there. So, if I have a patient with diabetes, which is the 6th leading cause of death, why on earth would I give them the 4th leading cause of death to deal with it? Do you understand my point? If I have somebody with diabetes, I give them pills, and that's the 4th leading cause of death? What in the world is going on? The other thing is our food has changed drastically. We used to eat whole unprocessed carbohydrates in the past. Today we're eating lots of fat, sugar, processed food. And it's so different. No wonder we're having health problems. I worked with Native Hawaiians for many years. I think you all know that. I worked with arguably the most obese population in the world, with the highest rates of diabetes, stroke, hypertension, cancer in the world. Some of my patients were 200, 300, 400, 500, 600, 700 pounds. My biggest patient was 890 pounds. So a lot of people would think that Hawaiians are naturally overweight. And by the way, their death rates are more than double the national average for heart disease, cancer, stroke, etc. Now, if it were all in the genes, though, how many of you think it's genetic? All in the genes. Well, if it were all in the genes, then wouldn't they be even more obese in the old days? But in the old days, you see no obesity. And what they used to eat, part of the problem is not their genes. The food has changed, right? How many of you have heard carbs make you fat? Right? You've heard that. Well, they ate a 78% carbohydrate diet. 78% carbohydrates. Why wouldn't they be fat in the old days? Today they eat less carb, and they're much more overweight. You know what's the problem? Staple food was taro in the old days. What's the staple food today? How about Spam? We're all laughing because we know this is true. Spam is not really a protein product. It's 83% fat. And over time, we've started to eat lots of fat in our diet. And so what I did was I took this concept, I tried to put Native Hawaiians back on their old diet. And we were so successful, we won a national award from the Secretary of Health. And this is a video that came out on CBS this morning about it.
It is 17 until the hour. A major health survey has named Hawaiians as the healthiest people in the country. But Dr. Bob Arnott, who was just in Hawaii and is now back in New York, tells us that's not true for everyone who lives here. Good morning, Bob.
Good morning, Harry. Hawaii does score #1 on the nation's Good Health Report Card, with the longest life expectancy and the second best infant mortality rate. But hidden in those statistics are the Native Hawaiians, who make up the unhealthiest group in the entire nation.
In fact, Native Hawaiians have the worst health of any ethnic group in the U.S. The death rate from heart disease is 3 times higher.
The foods that we eat today are very, very different from the foods that our ancestors ate. And that brought about some of the investigations.
The investigation began with Ed Aikala. At one point, the 50-year-old Hawaiian weighed 425 pounds, had a blood sugar level of 800, had severe chest pain, and almost died from kidney failure.
I overindulged in fat food because, well, ignorance is not a dirty word. It just simply means you don't know. And I was ignorant to a lot of things that concern nutrition value in foods.
I want you to show me what a typical 3-month batch of prescriptions look like for you. No way. 3 months worth of prescriptions? How did you ever remember to take all that stuff?
Sometimes I ended up in the emergency room with overdosing myself.
Ed's health is miraculously better. He's lost hundreds of pounds. His blood sugar, blood pressure, and cholesterol are all near normal. But his good health didn't come from a bottle. It came from a return to a traditional diet.
We demonstrated that eating this food will not only prevent many of their problems, but will actually reverse high blood pressure, high cholesterol. We've gotten people off of insulin who've been on insulin for much of their life.
The diet has saved Ed Aikala's life. He's totally off insulin. He's only taking 2 medicines out of that great big bag you saw, and what's more, he can eat all he wants. Ed's become a convert, encouraging other Hawaiians to drop the high-fat American diet and return to their roots. And he's made another convert, me. I'm off junk food forever. Eric?
All right, so I have several other videos, so I need to move on. But you can see that I took Mr. Aikala off his medication, which is not what they taught us in medical school. We published this in the American Journal of Clinical Nutrition. Cholesterol improved, LDL improved, triglycerides, blood sugar, so much for carbohydrates causing high blood sugar. In our studies, we use unprocessed carbohydrates and blood sugar decreases. And we're in Encyclopedia Britannica. Oh, wait. So what we did then was we converted this concept to one that everyone could participate in. We started looking at traditional diets around the world, and then we created a program that wasn't just traditional Hawaiian food, it was food from all over the world. Local food, brown rice, potatoes, tomatoes, vegetables. And this is a program that I now conduct at the MOA Center, the Tohono Hikari Temple up on Pali Highway. We've been doing this, and we're starting to reverse disease in just 10 days. And I'm going to show you a little video of people who have been on the program. If you know what that place looks like, it's off Pali Highway. You'll recognize the facility. But what I wanted you to notice about this was it's not just weight, cholesterol, blood pressure, but headaches are getting better, arthritis is getting better, and I can't tell you how many people with autoimmune disease improve, aches and pains improve with a holistic approach. We don't do just diet, we do the whole practice, including spiritual practices. But this is a little video about the results of our program.
Prescription drugs. And I mean, it's like how damaging being addicted to a narcotic is to an individual. This nation being addicted to prescription drugs is wrecking the nation.
I eat tons like 1,800 milligrams of nutrients. I ask for alternatives to pills, and every time I go in, I get another pill. I'm gonna have to be taking it forever. My doctor said I'm pre-diabetic. No, I get migraines every single day. A lot of lower back pain. I had night sweats. Appreciate that, man. No one. There's gotta be something better than this.
I have diabetes and all those things that kill Hawaiian. I believe it's going to be my last effort here.
There are many people taking a lot of medicines that they could get rid of if they were following a good diet and lifestyle the way we recommend. Some people say, oh, your diet is dangerous. A diet makes people well so fast that their medication becomes dangerous. Oh, ouch. Yeah, skip it.
You know, when I say skip it, I tell them to skip doses and I gradually wean them off. So that's how I start getting them off.
Actually, you should probably skip it.
I'm so surprised. I can't believe it.
Being that it's on the low side of normal, you probably don't need your diabetes medicine.
By the way, when the sugar drops very low, I can't leave them on medication. That would be malpractice.
Oh, why are you excited? Oh,
I lost 14.
I've already lost 11 pounds.
so that means you lost over,
7.
your blood sugar was borderline, you know, well, actually slightly high, 170. No, it's 90. Yeah.
Oh, but I have such a problem with reflux. Practically from the first day, it's been better. I have an unopened box of Prilosec.
Oh, it's 228. And after 21 days, it's 141.
Wow. Yes. Oh, ankle, knees, hips.
So,
And since I've been off the dairy and off the meat products, nothing.
your headache?
Yeah,
Okay.
I don't have any more headaches.
don't you think that's the way medicine ought to be practiced, where we start getting people off the medication? By the way, this is the data from my last program. Blue is their beginning. This is systolic pressure. Some of these people, I took them off their medicine, so they're bouncing up. But can you see the beginning is like this, and at the end, they're all starting to level out. 140 is abnormal. 15 people are abnormal before. 1, 2, 3, 4, 5, 6 are abnormal after. This one I stopped this medication. Diastolic, similar picture. Cholesterol, similar, everything's dropping. Triglycerides, all dropping. Blood sugar, all dropping on a high carbohydrate diet. So we have good data. Health isn't everything, but everything else is nothing without health. How many agree with that? Yes. What is a simple mistake that keeps people sick? The myth that pills keep you healthy, because pills never make you healthy. The truth is, if you're on medication, by definition, you're still sick. Insanity is doing the same thing over and over again and expecting different results. Albert Einstein. And people don't even want to spend money on their, we have a program, it's a 10-day program. We have to charge for it because I have to hire nurses and everything. But it's funny that they don't want to spend money on that. They'll spend money on their 401k and they'll lose $2,000 in a day. But their biggest financial asset is your health, because more than half of bankruptcies are due to bad health. So it doesn't make sense not to. So the Dalai Lama says people sacrifice their health for their wealth, then they have to sacrifice their wealth to regain their health. They worry about tomorrow so much they never live for today. They live as if they will never die, then they die never having lived. Now, I have to leave in a little while. We have a program, a 10-day program that's starting, actually this coming up Saturday. We have a few more slots. Please let us know if you're interested. I have to leave myself because we're doing a screening of the program in just a little while. But if you're interested, if you can leave your name on a clipboard that I have, and we'll try to see if we can accommodate you. I want to thank you for this opportunity to share this information.